Welcome to week 36. Your baby's about 6 pounds now. It's about 20 inches long. Continues to grow rapidly towards the end here. 36 weeks is a big sort of milestone because at 36 weeks, if you were to have the baby now, the baby is more likely than not to be able to go home with you and not have an extended hospital stay. So you still really don't want to have your baby at 36 weeks, but 36 weeks is pretty good. And so at this point, I kind of changed my recommendations for people about when they have to think about going to the hospital. So we're no longer talking about preterm labor. Now we're talking about sort of more term labor precautions. So what I tell my patients at 36 weeks is that when you start having contractions that start becoming regular and more painful, you want to start timing them. When they're coming every 3 to 5 minutes and they're taking your breath away, that's when it's time to go to the hospital. So a laboring patient looks like this. So if you're making that face, you're probably in labor. If you're like, gee, I wonder if I'm in labor, you're probably not in labor yet. So that's, in my way, is probably a better way to tell than just timing contractions, but sort of how you're dealing with them when they're coming and how they feel. Now, everybody experiences labor a little bit differently. That's sort of a good rule of thumb. Now, if your water breaks, even if you're not contracting, head on into the hospital. You need to be attended to. You don't have to break traffic laws, but don't wait around all day. If your water breaks, it's time to go in as well. At 36 weeks, the Group B strep test will be done if it wasn't done at 35 weeks. Sometimes people don't have appointments at 35 weeks. So at the 36 weeks is another time when we might do the GBS test. Group B strep test is a little Q-tip swab to the vagina and the rectal area, and it sends it off for a culture for a bacteria that some people have on their skin. And if you have it, we simply just give you antibiotics when you're in labor. It's really nothing to worry about. At 36 weeks, we expect the baby to be a vertex presentation, that is head down. If we don't think the baby's head down, we'll get an ultrasound to confirm that. And if the baby's not head down, that's when we'll have a conversation about options such as a C-section or something called a version, where we basically try to push the baby and turn the baby by pushing on your tummy. At 36 weeks, you might experience what I call some of the soft signs of labor. These are things like the mucus plug passing, bloody show, or the baby dropping. All these things tell you that you're getting close, but those aren't reasons that you necessarily need to go to the hospital. It doesn't mean the baby's coming in a couple of hours. You can have these soft signs of labor and still stay pregnant for weeks to come, or it may be that labor's around the corner. So if your mucus plug passes, if you have some bloody show, or if the baby drops, you're okay, you're safe to stay at home and just sort of monitor things. If you're uncomfortable, it's always okay to call or go on in to get checked. But in general, those things don't mean that you need to rush to the hospital right away. So 36 weeks, you've got a 6-pound baby, it's growing like crazy, and really, if it was born now, has a better chance of going home with you than not. So you're in good shape at 36 weeks.
Medtwice.com